Today, we're diving deep into a fascinating and, often overlooked condition called mycetoma. It's this chronic infection that can have some really devastating consequences, but understanding its unique quirks is absolutely key to managing it. We're going to cover all the essential clinical knowledge you'll need.
So here's our game plan. We'll start with the basics, what is mycetoma? Then we'll dig into what causes it, see how it actually attacks the body, and then walk through the diagnosis and treatment. And to finish, we'll do a quick review of the absolute must-know facts.
All right, let's kick things off. First things first, what exactly is mycetoma? Let's get right to the core of it. At its heart, mycetoma is kind of like a slow-burning fire under the skin. It's relentless. It starts out in the skin, but then it just slowly burrows deeper and deeper, and over time it can destroy muscle and even bone. There's a very good reason the WHO calls it a neglected tropical disease. It tends to hit rural communities without great healthcare access the hardest, which makes it a huge public health challenge in some parts of the world.
You've probably heard it called Madura foot, which comes from a region in India. And yeah, the foot is the most common place to see it, often from minor scrapes and people who don't wear shoes, but this thing is not just about feet. Any little break in the skin from something as simple as a thorn prick can be the doorway in.
Now this next point. This is probably the single most important thing to get about mycetoma. What is actually causing the infection? Because the answer to that question, is it a fungus or a bacteria, sends us down two completely different roads when it comes to treatment. So mycetoma is split into two big categories. First, you've got Eumycetoma, which is caused by a true fungus. Madura mycetoma is usually the main offender. Then there's Actinomycetoma. This one's caused by bacteria that are really clever mimics of fungi like nocardia. And believe me, this isn't just for the textbooks. It's the critical fork in the road that decides the entire treatment plan.
And this is where it gets really interesting visually. The infection makes these little clumps of the organism called grains, and their color is a huge clue. I mean, a massive one. If you see black grains coming from the wound, you should immediately think fungal Eumycetoma. But if the grains are white, yellow, or even red, your mind should go straight to bacterial Actinomycetoma. It's a simple but incredibly powerful clue you can spot right at the bedside.
So you're probably wondering, how does a little splinter lead to so much destruction? Let's break down the step-by-step process of the infection and the classic signs it leaves behind.
So it all kicks off with a simple injury, like a splinter, that shoves the organism under the skin. Once it's in there, it forms this protective little colony called a grain. Of course, your body's immune system tries to fight back by walling it off. That's the granulomatous inflammation. But in the middle of this battle, these little tunnels or sinus tracts get created, and they let the infection just creep deeper and deeper into tissue, fascia, and eventually bone.
And all of that leads to this classic clinical triad. 3 signs that just scream mycetoma. And if you're studying for an exam, you'll want to tattoo this on your brain. First, you get a firm, painless swelling, called a tumefaction. Second, you see multiple little openings on the skin. Those are the sinus tracts. And third, those tracts start discharging those colored grains we just talked about. See this triad? Mycetoma should be at the very top of your list.
Okay, so seeing that triad is a huge clue, right? But it's not enough. We need definitive proof. So let's look at how we go from just suspecting it to actually confirming it in the lab.
The main question we're trying to answer here isn't just, hey, is this mycetoma? It's which kind of mycetoma is it? Is it the fungal one or the bacterial one? Because like we said, everything, and I mean everything, hinges on getting that right.
So the lab work starts with getting a good sample. Either grabbing some of those grains right from the discharge or taking a deeper tissue biopsy. Then it's off to the microscope. We use special stains to tell the difference between the fungal bits and the skinny bacterial filaments. We also try to grow the bug in a culture, but that can take a while. And finally, looking at the tissue biopsy itself, histology can give us that rock-solid confirmation, showing the grains surrounded by that inflammatory response.
And check this out, modern imaging has a really neat trick up its sleeve. An MRI is super useful for seeing just how deep this infection has gone, and it can show us a very specific sign, the dot and circle sign. It's exactly what it sounds like. It's the grain, the dot, smack in the middle of the inflammatory tissue, the circle. It's a really elegant, non-invasive way to back up the diagnosis.
All right, so once we know what we're dealing with, we can finally talk treatment. And as I've been saying, this really is a tale of 2 totally different therapies.
The difference here is just it's night and day.
Actinomycetoma, the bacterial kind, usually responds really well to long-term antibiotics, and you can often avoid surgery. But Eumycetoma, the fungal one, that's a whole different beast. Antifungal drugs have a really tough time getting inside those grains, so the response is often poor. Treatment can drag on for years, and tragically, sometimes extensive surgery, even amputation, is the only way to get it under control.
And this brings us to the single most important public health message of all. With a disease this destructive, time is absolutely everything. Catching and treating mycetoma early, before it has a chance to chew through deep tissue and bone, is the key to preventing permanent disability and disfigurement. To put it simply, early diagnosis saves limbs. Period.
Okay, we have covered a ton of ground. I know. So let's wrap this up with a quick-fire review of the top 5 most high-yield points you absolutely have to remember.
All right, let's drill these in one last time. Number 1, the classic triad: swelling, sinus tracts, and grain discharge. 2, the 2 types: fungal Eumycetoma and bacterial Actinomycetoma. 3, use grain color as your cheat code for diagnosis. 4, Madura mycetomatous is the big bad fungus. And 5, the treatment is worlds apart. Knowing these points is absolutely fundamental to tackling this tough disease. Thanks.